The honourable member for Calgary Mountain View, followed by Edmonton Strathcona.
Thank you, Mr. Speaker. Mr. Speaker, the Minister of Health is deliberately withholding Alberta Health Services quarterly 1 and quarterly 2 reports because he knows the results are poor. For example, it would likely show that critically ill people are unable to get into the hospital in Medicine Hat, while at the same time the Redford Conservatives are cutting registered nursing positions up to half the nurses in one ward. To the Minister of Health, why at a time of increased seasonal demands and overcapacity in a hospital would you be cutting the number of registered nurses in Medicine Hat?
Honourable Minister.
Well, Mr. Speaker, I'll be pleased to answer without attributing motive to the honourable member. If he is interested in the demand for nurses in Alberta, I can tell him that today there are a total of 436 vacancies for registered nurses in this province. 152 of them are full-time and 210 are part-time, Mr. Speaker. So as we've said before and as we'll continue to say, the demand for nurses is only increasing in our province and their role is only increasing in province as well.
Well, the Minister conveniently ignores the role of RNs versus LPNs versus nursing assistants. That is the real issue, Mr. Minister. Given that nearly 2 years ago this government pledged $7 million to Park Place Seniors in Medicine Hat to build 80 seniors beds, and nothing has been built to date, will the Minister see the obvious connection to the lack of seniors' care and spaces in this overflowing hospital?
Honourable Associate Minister.
Mr. Speaker, the issue maybe is not quite tied together. The community and the developer are working on some zoning issues in the community, and as I understand it, that there's a resolution to that around the corner.
It sounds familiar. Fort McMurray has gone through the same, it seems. Finally, to the Minister, given reports of continued private home care failures, when are you going to ensure that state-of-the-art nursing supports are in place both in hospital and out of hospital?
Honourable Minister.
Well, Mr. Speaker, I've already spoken to the very aggressive measures that the government has taken with respect to ensuring quality in home care in our province. I will say again, Mr. Speaker, that no provider that cannot deliver the quality of service that Albertans expect and deserve will be allowed to operate in our province. Mr. Speaker, with respect to the member's comments around nurses, as a physician, I'm sure he would want us to make sure that our valuable registered nurses are serving where their skills are needed most throughout the system, and that's exactly what we're doing, Mr. Speaker.